The nurse was devastated when she got a letter, an anonymous letter, sent to her because it was a practice that our peer review was not to be talked about amongst your peers. The event had happened almost 6 months prior. She had already reviewed the event with her supervisor, had already emotionally gone through the struggle of what happened with the event. She came physically to be present at the peer review case to try to speak to what happened. She walked out in tears. The actual outcome of the review is that the nursing did everything appropriate, had followed all the appropriate care guidelines, but emotionally she had been devastated and felt ostracized by her peers, which is the exact opposite of what we want peer review to be. So I asked Beth, what can we do, what can't we do? And it was in that moment that she presented her idea, her project that she had been working on, and it sparked with me, it hit that that's what we want.
It was really actually good timing because I knew that Allison Beffa's goals at St. Clair Hospital were to really improve upon and strengthen the unit practice councils and the entity practice council. And since my model really worked through them, there was really a built-in communication path to ensure the sustainability of the program. We then partnered up with some key stakeholders, Chris Zergis for infection prevention and Barb Gubser, who's the administrative director at Cardinal Glennon, because those were environments that we needed to have support from and we needed the subject matter expertise. We're rolling out hospital by hospital, and we've extended outside of the Missouri area as well. We found that unit champions really provide ownership for change, and they engage the bedside staff. And nursing peer review is an essential component to professional nursing practice, so it was really important that we had a really solid process and a really functional process. Other departments have responded very favorably to this. They are a part of it as well because of the support and the structure that they provide for nursing care. Physicians have embraced it because it obviously advances their goals as well, safe patient care, the best outcomes for our patients.
I always give the same example. Whenever you have a rental car and you go on vacation, how many of us actually take the time to wash that rental car before we return it? None of us do because we don't own it. We don't have a buy-in or a stake in how that rental car looks. It's the same thing with our peer review change. If we give them ownership in the process, they'll take the time to care for it and actually buy into those outcomes.
So it really is about delivering a quality of care that they own and owning the quality of care that they deliver. So the patient really benefits in improved clinical outcomes, hopefully shorter stays, and an overall better experience.
If nurses have a voice in what they do and impact the change in their practice environment, they want to stay.